Hello, today we'll continue with our series of lectures on behavioral science. The topic we're going to cover today is aggression. It's very important to get to know this topic, especially when we make a relationship or a connection with some of the disorders that we'll cover later on that are categorized in the DSM-5. We should be especially concerned with the conduct disorder and the antisocial personality disorder. That one of the criteria for diagnosis has a lot to do with one of the criterions for diagnosis for those disorders has a lot to do with aggression. So it's important for physicians and for any student of psychology to understand the basis of aggression. Why do people turn violent, and what can be done about it? And U.S. doctors in your rotations will sooner or later, unfortunately, will encounter cases of victims of aggression. So it is important for you to know how to proceed and what is both the ethical and the legal and also the medical procedures when you face intense cases of aggression with any of your patients. So we'll also pay some attention to rape and what to do in those cases and why does rape happen. Remember that all of these topics will be covered in the USMLE, so at the end of this lecture we'll do some review questions with the ones that resemble the ones that appear in the USMLE exam. So let's begin. Well, when we talk about aggression, aggression is pretty much a synonym of violence, so it's important for us to understand what are some of the causes of aggression and violence. And we'll get shortly to the psychological and the biological causes of violence, which for you physicians is very important to know. But we should also consider the social causes of violence. I wouldn't say that there is one single cause of violence or aggression. And there has been a lot of debate about what exactly causes aggression and violence. But we shouldn't leave aside the social causes. So it's probably a mix of many factors, both psychological and sociological, and of course the psychological is the biological. So within psychological causes of aggression, there are also biological causes of aggression. But before we get to that, let's consider first the social causes. And first of all, aggression is related to poverty. Those countries, not necessarily the poorest countries, are the most violent. The United States is far from being one of the poorest countries in the world. In fact, it is one of the richest. But it is nevertheless true that it is quite violent, at least compared to other countries that are as prosperous as the United States. So, but having said that, we can still make a strong correlation between poverty and aggression. And even for instance, even inside the United States, those areas that are poorer tend to encounter higher rates of aggression. So for instance, African American communities, well, it's a very unfortunate fact that yes, they are very poor, and it's also, well, not extremely poor, but they're among the poorer communities in the United States. And it's also unfortunately true that African American communities are at higher risk of violence. So as I was telling you in a previous lecture, we can complain about all racism, and it's a very legitimate concern. But it's nevertheless true that a black man is more at risk of being killed by another black man than by a white police cop. And this may have to do with poverty. I mean, when people are poor, well, they have less access to education, they are under greater stress, they may not be able to cover all their material needs, and all of that increases the chances of that the community may turn violent and that people may turn violent. Okay, having guns in a society also seems to have some relationship to aggression. Now, this is a very politicized topic in the United States, as I'm aware. The National Rifle Association will probably beg to differ on this one, what I'm saying. But I think the statistics are out there that show that those countries that have tougher gun controls usually have better numbers when it comes to violence. I think this is common sense. I mean, if a government tries to control weapons, then there's not as great as an opportunity to kill other people. Now, that doesn't mean that there aren't any other ways of killing people, of course. I mean, if you take a look at the Rwandan genocide, that monstrosity was not carried out with machine guns, but rather with machetes, and machetes are not outlawed in the United States or in any other country. And I think the people that oppose gun control, they may also have some arguments when they say that really those laws apply to the common citizens, but criminals will always find a way to have laws, to have guns. So if criminals sooner or later will have guns, then we might as well allow everybody to have guns in order for the common citizen to be better defended against crime. And that may be an argument, but I think that overall, and the argument, the evidence seems to point in the other way, that the more a society controls weapons, the less violence there is. Another important factor is inequality. So it's not so much poverty, but how unequal societies are. And this is undeniably true that those societies that are extremely unequal tend to have more violence. So I can speak, for instance, for Latin America. Latin America may not be as poor as some African countries, but it is hugely unequal. And in Latin America, the more unequal a country is, the higher the violence rates. And there was a famous philosopher in the 19th century. His name was Karl Marx. You probably heard of him. And Marx, amongst many other things, he put forth this argument. And he was basically saying that, well, when societies are very unequal, there is a tendency for people to clash amongst themselves. And, there are many psychological reasons for this. There is envy, there is resentment, there is a sense of injustice, and when people feel that that society is not being fair to them, that they are not getting the piece of the pie that they deserve, they will usually get weapons and try to change things via violence. So inequality is another important social cause of violence. Broken families. Yes, of course. Broken families are responsible for a lot of bad things in society, and violence is one of them. So, I mean, you need good parenting in order to educate children about how to control violence, how to behave properly, how not to participate in aggression towards others. But of course, if there are no parents around, or if the parents don't pay attention to the children, or if there are single parents and so on, then it's much more difficult to perform that education labor in the home. And of course, that lack of education at the family level increases the chances that people will eventually become violent. However, despite all these social causes, it is nevertheless true, and this has upset some people, but it's nevertheless true that historically violence has decreased. And a very famous psychologist, a Harvard psychologist, Steven Pinker, has defended this for many years. He argues that, we may complain about all violence all we want, and sure, there are the Columbine shootings and all of that, and 9/11, and the war in Syria, and the war in Afghanistan, and so on, and now threats against North Korea. But it is nevertheless true that over the last 2 or 3 centuries, violence has decreased significantly. So you can see a graph there of, for instance, how homicide rates, at least in Europe, has declined over the last 600 years. And of course, these are homicide rates per 100,000 people. Steven Pinker has been in many debates about this, and he argues that for a specific number of reasons, violence has been decreasing. One of them has to do with literacy rates. I mean, the more education there is, the less violent there is, and other humane advances in the history of Western society. So, I mean, we may be all alarmed by cases of violence, but we must nevertheless admit that we have made some significant improvement. Here is a world map of homicide rate by country, so you can see what the most violent countries in the world are. And unfortunately, Latin America gets the first place, and some countries in sub-Saharan Africa. And of course, there is a correspondence between, first of all, inequality, as I was saying. Latin America, probably the most violent of all regions. Latin America is probably one of the most unequal regions of the world. I mean, if you go to any Latin American country, you can see some great mansions living side to side to some very to some slums. And it's quite interesting that if you see here the map in Latin America, you see countries such as Mexico, Venezuela, Brazil, Colombia. But if you see Cuba, Cuba doesn't have the same level of a homicide rate as the rest of Latin America. Now, we may criticize Cuba all we want, and I'm one of the first to criticize Cuba, but it's nevertheless true that in Cuba there is higher equality than in the rest of Latin America, because of course it's a communist country. So that seems to drive homicide rates down. Inequality is a big predictor of violence. And the same goes, well, but it's not the only predictor, of course. I mean, it's also, if you take a look at Europe, those countries that have tougher gun laws, such as Spain, Italy, or Germany, those are the countries that have a lower homicide rate. So it's a complicated issue, and the sociological variables for the sociological causes of violence are quite varied, and we're still not sure which one is the most important, but all those factors must be taken in. For many years, there has always been concern also about whether or not the violence in media really cause aggression. And there is a debate in the United States about this, and U.S. physicians should be concerned about this, because maybe you will encounter some patients that have some level of violence, and you may wonder whether or not, if they watch too much violent television or if they play violent video games, if that has anything to do with their aggressive behavior. The jury's still out. I mean, some people claim that violence in media may actually be cathartic. And catharsis is when you display some of your energy or your aggressive energy towards other things that will not necessarily suffer. So, for instance, if you are upset with your friends, and you know you have a drive to be violent against them, well, you may suspend the violence against your friends if instead, let's say, that you hit the wall, or that you hit something else, and that's not actually a person. Well, that's catharsis, because you're driving the negative energy or the negative violence towards something that is not as problematic. And there are some people who claim that playing video games or watching violent movies may actually be cathartic. I mean, people have inner violence and they need something where they can discharge that violence. And violence in the media, in this case, may actually be cathartic. Now, this is not a favorite hypothesis against psychologists, because there have been some experimental studies that have found correlations between the viewing of violence and increased interpersonal aggression. Now, some people might say, well, look, but I mean, if we go by that argument, then we should never read Shakespeare, because in Shakespeare a lot of people die. And that may be true, but, you know, we should still keep in mind that in Shakespeare's days, violence was much more common than today, very much as the graph that I previously showed you, that how in the 1600s the homicide rate was much higher than it is today. But at any rate, reading Shakespeare is different from playing murder simulators in video games. So, as I was saying, you know, the jury's still out. And the fact is that not all psychologists are convinced about whether or not the violence in media really causes aggression, so it's still a topic up for debate. There was a famous experiment in psychology about whether or not violence in media do cause people to be more aggressive. And if you remember from the lecture on behaviorist theory and learning theory, we talked about role modeling as one of the techniques for behavioral change. So when children, I mean, it's not only conditioning how you can change someone's behavior, it could also be through modeling. If people watch the way other people behave, they could imitate that behavior. So the psychologist who came up with this idea, Albert Bandura, who was very much related to the school of behaviorism, Bandura designed an experiment to test whether or not children who watch violent behavior eventually become violent themselves. So in that experiment, a group of boys watched some adult punch a bubble doll, and another group watched the doll without being punched. Now the results came out, and the first group, that is to say the group of boys who did watch an adult punch the bubble doll, that first group exhibited more aggressiveness towards the doll than the other group. So that has been taken as evidence that, well, yes, violent video games and violence in the media does have some influence on aggression. But that experiment has been criticized for many reasons. I mean, maybe children understand that it's just a bubble doll, and if they watch adults hit someone else, a real person, then maybe they will not follow that behavior. Or maybe the children are just punching the bubble doll because, well, the experimenters in some way induced them to do it. So, there were some flaws in this experiment, and although it has been very famous, it has not been a conclusive experiment. So I think the jury is still out on whether or not violence in the media really does cause violence in the real world. And there are some people who argue in favor of it, and there are some people who argue against it. I can tell you that Steven Pinker, the psychologist that I've been telling you about, he decidedly thinks that violence in the media is not a factor to explain violence in the real world. Let's consider the biological basis of aggression and how biology and aggression relate to each other. Well, first of all, in human behavior, there is an association between sexuality and aggression, and to a certain extent, the biological features that control sexual behavior may also have an influence on how aggressive people are. So both sexuality and aggression have some relation to the hormonal system, and we can expect to see some correspondence between hormones and aggression. So males tend to be more aggressive than females. This is not a stereotype. I mean, this is hard biological data. As I was telling you, our hormones do play a role. So androgens have something to do with violence. Androgenic or anabolic steroids, which they are chemically related to hormones and so on. They are the ones that are used by bodybuilders, and this may eventually cause increased aggression. So people who use steroids are at a higher risk of being more aggressive. Although, of course, there are many media myths about how aggressive bodybuilders may come after they take steroids. There's what's called roid rage or steroid rage, and allegedly that's when bodybuilders are just become violently out of control because of the action of the steroids. But that's a myth. I mean, it has not been really documented to that level. But it's nevertheless true that androgenic or anabolic steroids do play a role in aggression. And that in that sense, hormones have to do something with this. Estrogens, progesterone, and anti-androgens, which are blockers of androgen receptors, on the other hand, decrease aggression and may be useful for treating sex offenders. So yes, I mean, there are hormones that increase aggression, and there are some other hormones that decrease aggression, or that are other substances that work as blockers of androgen receptors. So you must remember that the psychological is the biological. So and the psychological reasons for aggression may themselves be biological reasons. Aggression may also be related to substance abuse, and this is where you physicians come in, and you should try to figure out when you have a patient that's extremely violent, whether or not they're on something. When we get to substance abuse, we'll cover in a little bit greater detail what the intoxication symptoms for each drug is. But for the time being, let's keep in mind a few the way some of these drugs work and how they influence on aggressive behavior. So low doses of alcohol decrease aggression. are probably quite aware of this. I mean, we've all probably had some low doses of alcohol, and when people have low doses, when people begin drinking, well, they become more inhibited. I'm sorry, they become less inhibited, so they're more friendly, more outgoing, and in low doses, it decreases aggression, so people get along. But high doses, I mean, if you eventually get drunk, that increases aggression. So yeah, you as doctors, when you have to deal with people that are drunk, that are intoxicated with alcohol, you should expect some aggression from the patients. Opioids or heroin users are not usually aggressive. Because of course opioids are not really stimulants. I mean, you can expect more aggression in drugs that are more stimulants, and that it affects the neurochemistry with stimulant neurotransmitters. So increased aggression is more associated with the use of stimulants, basically cocaine and amphetamines. So that's something to watch for. And of course, it's not only hormones that have to do with aggression. Neurotransmitters also have to do with aggression. So there are some neurotransmitters that inhibit aggression. First of all, there is serotonin and GABA. Those are neurotransmitters that are usually they usually inhibit aggression. That is to say, they do not promote aggression. So recommended drugs for aggression treatments, well, they're the antidepressants. Those are the ones that usually increase serotonin levels. Benzodiazepines, antipsychotics, and antimaniacs. All those drugs may have the effect of decreasing aggression. And of course, for instance, antipsychotics that are used for patients with schizophrenia. Schizophrenic patients are not necessarily violent, but they may be if they're too disturbed. So antipsychotic medication may eventually inhibit some of their aggressions. Now, neurotransmitters are not the only way that the brain influences aggression. There may also be head injuries, especially brain injuries in the temporal lobe, in the frontal lobes, and the hypothalamus. All of those areas, when they're injured, they are associated with aggression. And there is a very famous case in the history of neuroscience that is usually addressed to explain the influence of brain injury with aggression. In the 19th century, this is the case of Phineas Gage. Now, Phineas Gage was a 19th century railroad worker in the United States, in America. And by all accounts, he was known as a very nice guy. He was very kind, he got along with other people, his friends were very nice to him, and he was very nice to his friends. However, he suffered an accident. An iron rod traversed his frontal left lobe, kind of as you see in the image. So it was quite a serious injury. Now, astonishingly, Phineas Gage, even though an iron rod traversed his whole brain, he did not die. Because brain injuries may be fatal, but not necessarily so. I mean, there have been many cases of some external agent touching the brain, and that may have some changes in behavior, but they're not necessarily fatal. Now, it was definitely the case that after Phineas Gage had this injury, eventually he went through a sudden transformation. So from being a very nice guy, and from being something that was that got along with someone that got along with other people, and that he was not aggressive at all, he became an unreliable and very aggressive man. I mean, he used to have social inhibitions, and after this accident, well, he became disinhibited, and he eventually became much more violent. Now, the case of we're not exactly sure what happened with the case of Phineas Gage, but ever since, neuroscientists have used his case as a hint that most definitely brain injuries can definitely affect the way people behave, especially when it comes to aggression. So apart from neurotransmitters and head injuries, genetics also plays a significant role when it comes to aggression. Uh, we're not really sure what specific genes cause aggression. I mean, we still haven't isolated a particular gene that causes someone to be a killer or something, anything like that. But there have been some hints. For some years, there was the hypothesis that people with an additional Y chromosome may have been at an increased risk of being violent. So the XYY chromosome that's found in only 0.1% of the general population, but it's found in 3.5% of prison population. So there were some geneticists and biologists who argued that this additional Y chromosome, that by the way doesn't really have any other effects on people. I mean, people with XYY chromosome are normal. They have a normal behavior and physiological features. But for some time there was the suspicion that this may have had something to do with aggression because of that disparity. And it certainly is a considerable disparity, going from 0.1 to 3.5. But even if the difference between 0.1 and 3.5 is great, the people who criticize these allegations claim that, look, there may be a disparity between those two numbers, but they're still very low numbers. I mean, if it were, let's say, 20% in the general population and 80% in the prison population, okay, a case could be made. But just because it's 0.1% in the general population and 3.5 in the prison population, 3.5 is still a very low number. So, you know, the consensus is that there is no conclusive evidence from this finding of the XYY chromosome being more common in the prison population, but it's still the jury's still out. I mean, there are some geneticists who still consider this hypothesis, and for the time being, it's not going anywhere. I mean, it's still out there for people to discuss it. Now, apart from these XYY chromosome findings, it is nevertheless true that there are greater concordance when it comes to aggression in monozygotic twins, that is to say, twins that have identical the genetical makeup, than in dizygotic twins or fraternal twins. Those are twins that are not genetically identical. So the chance of two monozygotic twins being both aggressive people is far higher than the chance of two dizygotic twins being both aggressive. So that's another hint that maybe aggression is actually in the genes. Evolutionary psychologists, or some of them, not all of them, but some of them have theorized that it's quite likely that we have killer genes, and there's a killer ape theory put forth by a famous evolutionary psychologist, Robert Adry. And basically what this theory claims is that being aggressive was a natural advantageous in our evolution as a human, in the evolution of the human species. Because I mean, if you were a killer and you killed your competitors, then you had greater chance of spreading your genes more. So the ones who survived were the ones who were more violent. Now, of course, this has a counter argument, and that's both the group selection theory and the altruism theory, which claims, well, yeah, I mean, being a killer may have helped you spread your genes more, but on the other hand, you also needed to cooperate with other people in order to make sure that you survive and that your genes were spread out. So the jury is still out here also. Evolutionary psychologists are not all that clear whether or not we have genes to be killers. So we're not so the killer ape theory has not been defended by all evolutionary psychologists. But there is one important factor, and this is widely accepted by evolutionary psychologists, and that is Hamilton's rule, or kin selection. We talked about this in a previous lecture. There is a tendency for not only for human beings but for all animals to have to behave more altruistically towards those other animals with whom we share a higher proportion of genes, that is to say relatives. So the closer genetically you are to someone else, the less likely you are to be aggressive towards that person. And the more distant someone is genetically to you, then the more likely you are to behave more aggressively towards that person. So there is a higher incidence of aggression towards non-kin. Remember when we talked about the Cinderella effect, we mentioned that it was children that are adopted are at higher risk of child abuse than children that are not adopted, that they're raised by their biological parents. And this is something to be kept in mind by physicians when dealing with aggression. Okay, so let's delve in now into some matters that have to do with aggression and that especially concern you physicians, and that is the abuse and neglect of children and the elderly. You have to, when you do your rotations and you're in emergency rooms, and also when people visit your offices, you should always watch out for abuse-related injuries and how to differentiate them from non-abuse injuries. Because remember that at least in the case of children, you have the ethical obligation to report injuries if they come from abuse. So you should be aware of which injuries are more likely related to abuse and which injuries are more accidental. So at least in the case of children, non-abuse injuries, maybe bruises and scrapes on the chin, on the forehead, on the knees, and on the elbows. I mean, those are relatively common. Children may be playing in the playground and they may fall, and they may usually get those bruises. If you see those bruises in children, you shouldn't really suspect that they are being abused. Now, nevertheless, there may be some injuries that are non-accidental, but they may not necessarily be abuse injuries. And those are some cultural practices that include doing some injuries on the child in order so that the child will get better. Now, if you don't have enough cultural sensitivity, and remember we talked about this in the lecture on the doctor-patient relationship and the lecture on cultural differences between different ethnic groups. If you don't have cultural insensitivity, you may come to think that that child is being abused, but not necessarily. I mean, maybe some children have some bruises that do not come from accidents, but they may come from alternative therapies that may look like injuries to you, and in fact they actually are, but the parents do not really intend to harm the child. Now, in those cases, there's some debate about whether or not you should report it, but given the need of the doctors to have some cultural sensitivity, the consensus is that you shouldn't report that as children abuse or neglect. So, for instance, there is the issue of cupping. In Chinese culture, there is an alternative medicine treatment that consists in putting some hot objects on children's back, and also this also works on adults because allegedly that, according to Chinese traditional medicine, that drains energy better, so there is better energy flow. Now that leaves some mild injuries on their back. If you see that, you may think that the child is being abused, but again, you should be culturally sensitive in order to understand that this is a cultural practice, and that even though the child may have been injured and it may not have been an accident, it's not properly child abuse. And in fact, there is a movie that I recommend to you. It's called the Huasha treatment, and it's about a Chinese family living in America that performs some traditionally some treatment on their children that comes from traditional Chinese medicine. It's not properly cupping, but it's actually putting some scars on the child's back. And because they live in New York, they are the Child Protective Services have to report that, and the parents. I don't remember if they go to prison, but the child's custody is taken away from them. And of course, this presents an ethical dilemma about cultural relativism, about whether or not doctors should be culturally sensitive. And the message of the movie is that doctors should indeed be culturally sensitive, and that they should understand how other cultures cope with diseases. So if you see some injuries on the child's back, um, that's not necessarily child abuse or neglect. And here is a famous image of a very famous guy having the cupping technique applied to him. Now, most doctors will agree that cupping didn't really have a great effect on Michael Phelps swimming, and that it was actually a loss of time. But that's not the point. The point is that U.S. doctors have to understand the patient's culture, and you shouldn't report as child abuse something that's clearly not intended to be as child abuse. Okay, so let's talk some more about what child abuse is and how you can detect it. So far we have covered injuries that are not considered child abuse. Those are accidental injuries. Let's talk now about some injuries that U.S. doctors will probably see, and that you should report them as child abuse. Well, in the case of child abuse, the most likely abuser are usually the closest family members. So, for instance, the mother. I mean, it's not very likely that someone totally unrelated to the child will abuse the child. When you see cases of child abuse, most likely it is someone who's related to the child. And unfortunately, most cases, most of the time it's step parents or stepfathers usually, and that's probably. I mean, whenever there are cases of child abuse, the police and physicians, their first suspicion is usually on the stepfather. And this may go back again to the Cinderella effect that I was mentioning. I mean, for some evolutionary reasons, their step parents may have good reasons to, from an evolutionary point of view, they may have good reasons to abuse their child, because, well, they may want to apart them from their real biological children so they can spread their genes better. So this is what the Cinderella effect is. And doctors should be on the watch, especially in relationships between children and stepfathers, which is the relationship that is at a higher risk of child abuse. Now, of course, that doesn't mean that stepfathers are inherently violent, but it's something that you should be on watch in case of a suspicion of child abuse. Now, how do you know whether or not a child is abused? Well, there are some behavioral characteristics of abused children. So, first of all, hyperactivity, mild retardation, those are characteristics of the abuse. But you should also watch for characteristics of the abuser. Substance abuse, poverty, social isolation, and having been abused. And this is very unfortunate. I mean, there are high rates of repeating behavior here. If you have been abused during your childhood, then that increases the risk of you abusing other children when you grow up. Now, some of the signs of child abuse. Well, first of all, neglect. So a kid who is not properly groomed, doesn't have good hygiene, and who is undernourished, who has some nutrition problems, that may be a sign of child abuse. Bruises. Now, remember, you have to differentiate abuse bruises from non-abuse bruises. So if you see bruises on the knees or the elbows, well, that's most likely because the child fell. But there are some other bruises that are definitely signs of child abuse. For instance, bruises on the buttocks, so that's when probably parents have spanked the child, or the lower back. That's usually another area of the body where adults usually hit their children for child abuse. So, if you see those signs, you should suspect that maybe child abuse is going on. And also fractures, spiral fractures due to limb twisting. This is very common. I mean, there is a very nasty habit of some parents of twisting kids' arms in order to make them comply. Now, because bone development is not fully achieved during childhood, there is a greater risk of spiral fractures. So if you see spiral fractures in children, it's quite likely that this has been due to limb twisting, and this is a sign of child abuse. Another sign is for cigarette burns, ankle rope burns. You should suspect that this is child abuse because there are some habits of parents of tying a child either to a specific place or and they do this by tying by using a rope and tying their ankles so they won't move. So if the parent, I mean, that's an abuse in itself, but it's even more of an abuse if they tie the rope too tightly, and that causes some burns in their ankles. And also another sign that you should watch for is burns due to hot water. So this is another common way of abusing parents to punish their children. They either throw hot water at them or they immerse them in hot water so that they allegedly they may be more calm and that their behavior, they settle down. But of course this is a severe sign of child abuse. And there is also what's called a shaking baby syndrome. Some parents who become impatient with children and become desperate because the child is crying too much, as a last resort, they may try to shake the baby so that the baby stops crying. Now, this is very dangerous because there can be retinal detachment or hemorrhage, and there can also be a subdural hematoma. So the shaking baby syndrome is more common than people think because, I mean, parents who are not necessarily abusing, but in a moment of desperation because the child is crying too much, they may shake the child. That may cause some significant damage, and that counts as a child abuse. So that's something that you should watch for. Okay, so children are not the only ones that are subject to abuse. There's also, you physicians should also have a suspicion of elder abuse because that's also quite frequent. So very much as in the case of child abuse, in the case of elder abuse, the most likely abuser is the closest family member with whom the person lives. And it's usually the one who has some economic dependency on the victim. So in the case of elderly people, well, elderly people usually have the means to provide for some caregiver, and if that caregiver becomes frustrated, although he may be economically dependent on the victim, the abuser may still nevertheless abuse the older person. So that's the profile you should always watch, be watchful of that situation. The characteristic of the victims or of the abuse, well, first of all, there is worsening cognitive impairment. So if you see a cognitive deterioration in an elderly person, I mean, that's not necessarily due to abuse. There are some conditions, of course, that include as symptoms cognitive impairment, but it should still be in your mind, you know, whether or not perhaps this could be a hint of abuse. And also increased physical dependence on others. This is another characteristic of the abused elderly. Characteristics of the abuser, well, substance abuse. You know, drugs and alcohol will always get people to do bad things. So if you see that, I mean, this is really a combination of hints. If you just see one elderly person with worsening cognitive impairment, that's not enough to suspect elderly abuse. But if you see that this person has a caregiver who comes drunk to the doctor's appointment, or seems to be poor, or seems to be economically dependent on the elder person, and also they seem to be socially isolated, well, in that case, then you may begin to suspect that there may be elder abuse going on. Because, as I was saying, those are the other characteristics of the abuser: substance abuse, poverty, and social isolation. Now, the signs of elder abuse, properly speaking, well, very much as in the signs of child abuse, there is poor hygiene, lack of medication, and nutrition. Bruises may also be a sign of elder abuse. They are a little bit different from the ones that you should use in order to suspect child abuse, because in the case of elderly people, the bruises that are more related to abuse are bruises on the arms from being grabbed by the abusers. But very much as in the case of children, if you see spiral fractures due to limb twisting, that's another sign of child abuse. I mean, it's not natural for elderly people to twist their own limbs. I mean, if they have spiral fractures due to limb twisting, it's because someone else has twisted their limbs. And very much in the same manner that during childhood bone development is not fully achieved, so there are at higher risks of fracture. Well, the same goes for older age. I mean, bones become weaker as you age. After some time in the development of life, and so older people are at increased risk of fractures. And if you see limb twisting, spiral fractures due to limb twisting, then that's definitely a sign of abuse. And very much as in child abuse, also cigarette burns and ankle rope burns are also signs of abuse. Other signs, well, internal abdominal injuries. Maybe if you see that, there is reason to suspect that they may have been hit around the abdominal area, and they have now internal abdominal injuries. And also depleted personal finances. I mean, if you are aware that someone has money, but all of a sudden they turn out that they do not have money, and the person who takes care of that person is drunk, and so on, then you may suspect that the caregiver is taking their money in order for them to buy more drinks and so on. So instead of using the finances to cover the caregiving expenses and to provide food for the elderly, they are using it for their own. So that's something to watch for. And also head injuries are also another sign of elder abuse. Now all of this has sequels. So in the case of child abuse, children who have been abused may develop dissociative identity disorder. These are multiple personality disorders. They are a little bit controversial in the history of psychiatry, but nevertheless, they are real. And those patients that have developed this disorder usually have a history of child abuse. Child abuse may also cause a post-traumatic stress disorder, depression, and substance abuse. And as I was saying, if you were a victim of child abuse, then you are at an increased risk of being a child abuser yourself. There is a special type of child abuse, which is sexual child abuse. And how do you come to find out whether or not a child has been sexually abused? Well, at least in order to at least grow a suspicion, you may see some signs. So first of all, sexually transmitted diseases. There's no reason for children to have any of these diseases, unless, of course, they have received it from their parents, for instance, the HIV virus, because of the mother-child transmission. But apart from that, if you see a child with any STDs, then there's suspicion that they're engaged in sexual activity, and of course, sexual activity in children is abuse. I mean, even if there's really no consent in this. If you see genital or anal trauma, that's another sign of child abuse. And also, and this is very important, if you see that the child has some knowledge of sexual activity. I mean, it is not normal for children to know details about oral sex or anal sex or vaginal sex or anything else. So if you see that a child is too interested in sexual activity or has a significant knowledge of sexual activity, that may be a sign of sexual child abuse, because that's not normal. And also excessive initiation of sexual activity with peers, that may be another sign of child abuse, of sexual child abuse. Urinary infections may also be a sign of sexual child abuse, although not necessarily, because there are other ways that a child could get urinary infections without necessarily engaging in sexual activity. But as I was saying, this may be a hint. Usually, the most common age for children to suffer child abuse is between 9 and 12 years old, and 25% of the victims are younger than 8 years old. when dealing with this, very much as in the other types of abuse, you should always be on the watch for the characteristics of the abuser. So when it comes to sexual abusers, most of them know the child. They're either cousins or uncles or neighbors or friends or whatever. Fewer than 5% are strangers. So if you suspect child abuse, well, one of the characteristics that you could be guided by is this. Sexual child abusers are also, they also have a high incidence of alcohol and drug use, and they may also have marital problems. So they have no alternative sexual partner. And of course, the hypothesis here is that that sexual energy is usually drained towards children because they fail at finding other sexual partners. Usually, they are non-violent. So sexual abusers do not usually, with children, do not usually employ violence as opposed to rapists against women. I mean, in the case of women, because women have a greater opportunity of defending themselves, violence has to be used. In the case of sexual child abuse, because children are more easily to handle and they comply easier with the commands of the adult, child molesters are usually non-violent. So don't be confused if you suspect that someone is a child abuser, a sexual child abuser, but you don't see that that person is violent. Well, that's not a sign of not being a child abuser. I mean, because sexual child abusers are usually non-violent. Okay, let's talk also about the physical and sexual abuse of domestic partners. As you probably know, male on female abuse is far more common than female on male abuse. There is an increased reluctance of abused women to report, and I think this is especially so in Latin America. I don't know how it works in the United States, but in Latin America, the machismo region of the world, there is an increased reluctance of women to report, and they may say, "Oh, but he hit me, but he loves me, and I don't want to go and file a report or press charges." And there's also, if there is a social expectation that the woman must put up with this, and that this may cause embarrassment to the woman, then that's another social factor that increases the probability that the woman may be reluctant to report domestic violence. The physical evidence of domestic violence, especially in the cases of women, well, bruises, broken bones, black eyes, and in the case of pregnant women, a very clear sign of physical abuse is injuries in the baby zone. Husbands that are violent and that batter women, when the woman is pregnant, they do have a tendency to injure the woman in the baby zone. And of course, this is extremely dangerous because it could cause an abortion. Usually, the cycle of abuse in domestic relationships is, first of all, there is a building of tensions. Then there is battering from the husband to the wife. And after the violent act, there are apologies, and this is quite common. I mean, the husband has fights and argues with the wife. The tension grows. They hit the wife, and after that, the husband begins to cry and he begins to ask for apologies, and he's saying this won't happen again. But of course, it will most likely happen again, and this is why women should report it. Now, remember, in the case of the children, you are, as physicians, required to report these cases. In the case of women, only if the wife consents to reporting. I mean, you cannot do it for them because the ethical principle of autonomy applies here, and women have to decide on their own whether or not they report these cases. The characteristics of abusers when it comes to domestic violence, well, very much as in the other cases, they're more likely to be drug and alcohol users. They are impulsive. They tend to have a lot of frustration. They have lack of control, and they have low self-esteem. And the characteristic of victims, of the battered wives, is dependence on the abusers. This is very common. I mean, if a woman has economic dependence on the husband and the husband hits her, well, she may have to figure out whether or not to report what just happened, because if she reports him and she takes him to the police, the husband may suspend the payment to the wife, and it may be very difficult for them to go on. So it's a very difficult situation. Victims of domestic violence also have a tendency to blame themselves, and this is sort of a defense mechanism. This is the way they try to rationalize it, the fact that they are not going to tell the authorities about abuse by saying, oh, it was all my fault. And of course, it wasn't their fault, but the fact that they're vulnerable in economic terms may eventually lead them to blame themselves so as to prevent them from filing reports to the police. And it's also true that victims of domestic violence tend to have a low self-esteem. Now, what should you as doctors do? Well, there are some ethical obligations when it comes to abuse. Physicians must report suspected child abuse, even if it's only a suspicion. The authorities will eventually carry out an investigation and they will decide. So if it is just a suspicion, you are required to report it. And you don't have to tell the suspected abuser. So in the case of children, confidentiality here does you can make the decisions regardless of whether or not the suspected abuser knows. I mean, you don't have to inform them. And actually, if you inform them, there is an increased risk that the abuser may become an obstacle in future investigations. So it's better not to tell the suspected abuser and report the abuse to the authorities. If an elderly abuse victim seems mentally impaired, then it must also be reported. Because remember, the case of autonomy in medical ethics applies to children and to people who are mentally impaired. So if an elderly abuse victim seems not to be mentally fit, and you suspect that that person has been abused, then it must also be reported. And you don't need family consent for this. Now, in the case of adult victims who are not mentally impaired, then the autonomy principle applies to them, and it's up to the victim whether or not the abuse will be reported. However, the physician should encourage the abuse victims to report it. So the physician should counsel, but nevertheless should never coerce the victim into reporting. And let's talk about rape, which is a very particular type of sexual abuse. Well, rape is defined as sexual contact without consent. And you've seen all those slogans that say no means no. Well, that's what it actually means. I mean, if they say no, then it means no. And that's a lack of consent, and sexual contact without consent, it's considered to be rape. So it could be vaginal penetration, not necessarily by the penis. I mean, having intercourse is not the only way of raping someone. It could also be with the finger or with another object, some sexual toy or whatever. Erection and ejaculation are not necessary for rape. So maybe a woman could be forced to have sexual intercourse, and even if the rapist doesn't achieve an erection, if still forces the woman to have contact from her genitals with his genital, that's still considered rape. A special type of rape is called sodomy, or anal rape, and that's the insertion of penis or an object into the anus. Let's take a look at some of the profiles of rapists and victims so that you can have some hints about who's at risk here when you encounter these situations as physicians. The rapist is usually younger than 25, and it's usually known to the victim. It's quite rare to find rapists that are older than 25, and this may have to do with the fact that rape, although it may be an overt sign of aggression, it may also be a sexual process. So people who have increased sexual drive, well, they're obviously have a greater chance of being rapists. The victims are usually between 16 and 24 years of age. Usually rape happens inside the victim's home, And women who have had children and have been raped, they may not necessarily have vaginal injuries. Now, rape has some very serious sequels, and it's important to know them. Only 25% of rape cases are reported. And in the case of rape, there may be post-traumatic stress syndrome, so there may be some need for some psychiatric help. Emotional recovery time for rape victims usually lasts 1 year, and usually the line of treatment here is group therapy with other rape victims, because it's such a traumatic experience that support groups are highly encouraged. U.S. doctors should know that there are some legal issues that are important to take into account when it comes to rape. Lack of semen is not proof of innocence, as rapist may have because the rapist may have worn a condom, or he may have had difficulty with erection and ejaculation. But remember that ejaculation and erection are not necessary in order to consider it rape. Proof of resistance is not necessary for conviction either. And previous information about the victim, and this usually comes up in rape cases, is usually irrelevant. So if a rape victim used to be very sexually promiscuous and she liked to flirt with other people, well, that's usually not admitted in courts. There is also marital rape, and you should understand this. Just because a couple is married, that doesn't mean that rape cannot happen. A husband can rape a wife. In the 1970s, marital rape was criminalized. So there's an understanding that even if you're married, that you're not required to have sex with your husband. And if your husband forces you to have sex with him, then that's considered a marital rape. Unfortunately, in some countries, it's still not a crime, but the tendency is that it's becoming more of a crime in more countries. There is also date rape, and this is when the girl accepts going on a date with the guy, and there may be some mild sexual invitation, but nevertheless, the guy forces the girl to have sex with him. Now, this is called date rape because, well, yeah, there may have been some steps towards having sex, but the girl did not fully comply, and if she had sex without complying, then that's still considered rape. And there is also statutory rape, and that's when people have sex and they are under the age of consent. So maybe they gave outwards appearance of having sex, and maybe they even enjoyed the sexual encounter, but if they were below the age of consent, then that's still considered statutory rape, even if apparently there was no force involved. The age of consent varies across countries. In some countries it is 16, in other countries it's between 16 and 18. It varies across different countries. But make no mistake about it, it's still considered rape. What should a physician do if he encounters a case of rape? What should he do immediately? Well, first of all, be supportive and not to question the victim's testimony. There should be physical examination, and there should be lab tests. There should be a screening of sexually transmitted diseases, and also there should be a screening for the presence of semen in the woman's body. There should be some antibiotics or prophylactic antibiotics, that is to say preventive antibiotics, should be given, and because there is an increased risk that the rape may have put the victim at risk of infection, and postcoital contraceptive measures should also be given. So just in the case that the woman was pregnant or got pregnant as a result of the rape. 6 weeks after the rape, the doctor should discuss with the patient the emotional state and consider referring the victim to support group therapy, because you remember that this usually takes about a year to overcome emotionally, and so 6 weeks after the initial shock, the doctor should ask the patient, well, how she's doing emotionally, and if he sees some signs of disturbance, then maybe should consider her referring to group therapy, and if it's if it's a little bit more severe, then maybe to some psychiatric help. And there should also be pregnancy test, and because there is a danger that the patient may have been pregnant as a result of the rape. Okay, so let's do a couple of USMLE questions about this topic. A 33-year-old single woman who has a 4-year-old child comes to the emergency room and reports that she was raped by a man she was on a date with 2 days ago. The physical examination shows no physical evidence of rape, so no injuries or no semen. She appears anxious and spacey. Now, it is most likely that this woman, A, is delusional, B, is malingering. Malingering is inventing physical symptoms that are not really there. C, is suffering from hypochondriasis. D, is suffering from conversion disorder, or E, has been raped and the rapist used a condom. The most likely answer here is E. Remember that women who have already given birth, if they're raped, it may be that there is no, that they may have no vaginal injuries. And if no semen is found inside her, well, it may have been that the rapist used a condom. So the answer here is E. An 18-year-old retarded woman with an IQ of 50 agrees to have sexual intercourse with the 18-year-old president of the high school senior class. Sexual intercourse between these two people is best described as A, consensual sex, B, statutory rape, C, sodomy, D, child abuse, or E, sexual abuse. Well, this is something we did not cover in the lecture, but let's get to it quickly. Apparently, it's consensual sex because, I mean, she was not raped and, you know, she agreed to have sex. But it's actually a statutory rape because if she has an IQ of 50, that's considered mental retardation, if you remember from our lectures on IQ. And statutory rape is not only consensual sex with minors, but also with mentally retarded people. So in this case, it would be considered B, statutory rape.